Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we are conducting role play sessions, speaking role play sessions. And this is insulin injections. Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we are conducting speaking sessions for nurses and doctors. And this is Vaidehi Kokare with us. She is from Dublin, Ireland, originally from Mumbai, Maharashtra, India. This is role play number 1, insulin injections. Speaking role play 1, diabetes. At practice with Peter, insulin injections. These are Grandmaster class sessions. This is the role play card. So those who are watching the YouTube and others, you can just watch it, go through it for 3 minutes, and afterwards you can practice. Right. Nurse. So you're ready, you can start with your initiation. How do you start? How do you start? Vaidehi. Unmute. So you can start now.
Okay. Good afternoon.
Good afternoon, nurse.
Hello, I'm Vaidehi, one of the registered nurses working in this clinic. How may I address you?
Yes, you can call me Lincoln because my name is Abraham Lincoln.
Okay. Thank you, Lincoln. So, Lincoln, as I know today you are here to know about the insulin injection administration as your doctor advised you. Am I right?
Yeah, of course.
Okay. How do you feeling about this?
Actually, nurse, I believe that I have been managing my diabetes well, and I do not want to commence insulin injections. I don't understand why this doctor has recommended to make a change.
Yes, I understand your feeling, Lincoln. You're a little bit worried to move on to the insulin injection, but try to understand in this stage, like though you are taking the oral medication and following the diet, your high blood sugar level is not getting control with it. So now doctor has to start the insulin to take your blood glucose level control. Okay, so this is the needed in this situation. Are you getting me?
Yeah, of course, nurse. I understand what you are telling, but please tell me if there is any other way to manage my diabetes.
Um, to acknowledge your concern, I would say, see, you are following the diet, yeah, and according to the doctor's prescription, you are taking oral medication as well. I really appreciate you that you're following doctor's instruction, but this stage, your blood sugar level is still high, and this is a concern we have to resolve with the insulin injections. So this is the requirement for your current situation. Are you getting me, Lincoln?
Yeah, of course, nurse. I understand. Okay, if there is no other possible option, then you can explain me the procedure of taking the injections.
Definitely, I will explain you. Um, and do you have any concern? Do you have any fear about the injections? Anything? Please let me know.
Yes, of course, nurse. I don't know how to take insulin injections. I'm scared because never in my life I have seen such a thing or did such. I'm afraid of injections. So what should I do for that?
I know this is must be difficult for you, but don't worry at all. I will explain you the complete procedure in the clear instructions, and and it will be easier for you with the practice. So don't be worried so much, and let me just explain you the how you can take the injections. That like you have to wash your hands nicely, dry it up, and your insulin plane you can just adjust your dose in that, and hold the pinch your skin like on the stomach or on the thighs. You can pinch the skin and insert the needle 45 to 90 degrees, and leave it, press and leave it for the 5 to 10 seconds, and after that you can just take it out slowly. Yeah, and one more important thing during this, the each time of your injection you have to rotate the side, so it will be prevent the lump formation and the risk of the insulin absorption. Are you following me, Lincoln?
Yes, of course, nurse. I understand. I should change the place and I should not take the injection in the same place every day because I understand that. Yeah, how is that possible? If anything goes wrong when I take the injections, what will I do? Will there be any side effects and or after effects?
Yeah, I this is a good question from you, and I will explain you there is no such side effects. Maybe you can have the some bruises that could be happen during the injection. Some capillary, small capillary broken. So, but don't worry about that. The bruises it heals its own, and for that to prevent to prevention of this kind of risk, you have to just rotate the side. Sometimes you can take the injection on your abdomen, sometimes you can take your injections on thigh, and you have to just rotate the side. Just keep the two finger distance, and you can just you know take choose the another side. Are you getting me?
Yeah,
How
of
is
course, nurse. I can understand what you have doing. That's very clear. And what about the used syringes? Can I use them again or should I throw them off?
Oh, I appreciate your questions, Lincoln. Um, I would like to explain you regarding the needle disposal. You will get the some um different container that is only for the disposal of needle, and I will explain you how to handle. After the taking the injection, you have to carefully you have to discard the needle in the sharp container which will be given to you. Okay, so it will prevent your self injury from the needle, and once it is full you can just give it back to the pharmacy. Is that clear?
Yeah, of course, nurse. That's absolutely clear. And what should I do? Yeah, uh,
Yes,
I'm
Lincoln.
still scared about this one, but with your guidance, with your support, I can definitely do. But stay with me for some days until I am okay. Now you can watch me taking the injection. Okay, you just help me.
Sure, Lincoln. I appreciate your initiation and your understanding the importance of injection. And one more thing, I would like to add on to this instruction, that the storage of the insulin, which is very important part. Like you have to keep the vial in the refrigerator, and you have to check the expiration date as well, when it's expiry. So before the expiry finish, or if it is you found the expiry, you just have to discard it. And you should not keep the insulin injection in the sunlight or very high temperature. So the minimum temperature should be 2 degree to 8 degree Celsius, that you have to keep it in the refrigerator, not freezer, where the ice forms. Okay, so am I clear with this, the
Yes,
storage,
that's absolutely clear, nurse. Thank you very much for your valuable information and your patience and kindness. I really appreciate your cooperation and support in the following days.
Thank you, Lincoln. So we can go for the procedure of the insulin administration. Yeah.
Yes, nurse. Yeah, thank you very much.
Thank you, Lincoln, to understand the importance of the insulin injection, and hopefully you will follow my instruction. It will be easier for you to getting the insulin administration by yourself every day.
Yeah, that's fine. Thank you, nurse. Thank you once again.
Thank you, Lincoln. If you have any concern, just tell me. I can resolve you.
Yeah, that's very clear. So now we have concluded the role play, and now I'm going to give you some feedback. Yeah, right. You have said this word, these words. Are you getting me? Are you getting me? Maybe twice or thrice.
Yeah,
Twice
to
or thrice you
understand.
have told this one. I don't know why you are using the same phrase. You can ask
Okay.
something else. Is that clear?
Is it
I
clear?
hope that you understand everything. Like that alternative vocabulary, you can use alternative styles, presentations you can use. The next one,
Yes.
Lincoln, Lincoln, you are repeating the word Lincoln. So avoid telling too many times because I'm only with you. I'm Lincoln. I know you need not take my name every time because I know my name, that is it, Lincoln, and you know my name, it is Lincoln. It's just for a record purpose. But every time you need not say Lincoln, Lincoln like that. Next, number
Okay.
three, you are using active voice very much. You are using active voice too much. I will explain you. I will tell you. You should take this. You should take injections on the 5 places, locations. You should pinch. All this you. I will explain you. I will tell you. I will inform you. All this I, we, you. These are called personal pronouns. First thing is you have to avoid these personal pronouns as much as possible. For example, if I am speaking, I will not speak like that definitely. Then what? How I will speak? I will avoid them. I'll say like
Okay.
this. Insulin injection should be taken on 5 different sites. The 2 shoulders, the 2 thighs, and the area around the belly button or the umbilical cord. Where is I?
Okay.
Where is you? There is no I,
Mm.
there is no you. Just we are going straight into the subject. This is called strong information. Right. So avoid I, we, you. I am telling you, I will explain you. Only you can explain in the world. Nobody can explain. Are you so special that nobody else can explain and only you can explain? That's not the fact. So why are you giving importance to yourself? I will explain. So don't give importance to you. This is self-importance is not recommended in OET. You have to
Mm-hmm.
give importance to the patients. You have to give
Okay.
importance to the action. Okay, demonstration will be provided.
Yeah.
When the injections are taken, it will be monitored. Injections will be taken under careful observation in the initial days. After that, after gaining appropriate knowledge, independently, the injections can be taken without any assistance. So like that, no need to use. Then avoid active voice. Who is doing not important. What should be done is important. What should be done is
Okay.
important. So injection should be drawn. You take the injection. No. Injection should be drawn. Insulin should be drawn into the syringe. The okay, the knob should be pulled. Injection should be drawn. The area should be cleaned. You clean the injection, you do this one, you did this one. Why this use so many times? That is again repetition and it is redundant. So avoid these
Okay.
things. Then avoid repetitions. Are you getting me? Mr. Lincoln, Mr. Lincoln, Mr. Lincoln. Are you getting me? Are you getting me? Are you getting me? These repetitions. Avoid repetitions.
Okay.
And avoid unnecessary information as far as possible. Okay? Unnecessary. Straight into the subject. Then avoid ordinary words. Try to use some better words. Try to use some better words. For example, tell you, train you, inform you, educate you, explain, demonstrated. So better words, which is better, you try to use those words. So these are the 4 things I suggest you. Avoid personal pronouns, number 1. Then avoid personal pronouns, number 1. Next, avoid active voice, use passive voice, number 2. Number
Yes.
3, avoid redundancy, unnecessary information, repetition. All these things you have to avoid. And avoid ordinary vocabulary. Try to use C1, C2 vocabulary.
Okay.
Is that clear?
Yes.
And further feedback will be given after we get the dialogue. Okay.
Okay, sir.
The
Thank
written
you.
format, in the typed format we are going to get. And after that, we will conduct the session on how to improve your speaking with improvements. There will be 3 stages. First one, I'll give you corrections. There are some mistakes in your speaking style. So those mistakes will be corrected. That is number 1. So first one is identification of the mistakes. That means these are the mistakes, these are the mistakes. I'll tell you. Identification of the mistakes. First, you should know. Now we cannot identify any mistake because nothing is in front of us, right? And I'm a
Yes.
human being, I'm not a machine. So second thing, correction of the mistakes. Correction of the mistakes. I will correct all your mistakes. Whatever mistakes are there, first I'll identify them, I'll underline them. Okay. Then next one is, I will show that they are in red. Now after that correction of the mistakes, I'll give you in blue.
Okay.
Correction of the mistakes, I'll give you in blue. The next one, improvements will be there. There are some improvements. How to improve those sentences? How to improve those sentences? That also I'll give you.
Okay.
These are the 3 levels we are going to do in the next session. Instead of doing 100 sessions, we will do 30 sessions quality. Okay. Got it?
Sure.
No need
Yes.
to do unnecessary things. We'll do quality things the best. Okay.
Yes, sir.
So how did you feel regarding this particular session, role play? This is the first role play for you. You have done warm-up session, but this is the first role play. How do you feel? Anything difference?
Yeah, it's a big difference. Like always, I taught by to explain like this. Uh, so I followed the same, but you told me the other way and improve other ways. So and it will be like improve my vocabulary, the style of the speaking, everything. So I'm looking forward with you to be more corrected and with the quality sentences and unique conversation will be happen.
Yeah, that's really fine. Excellent. So thank you very much for the session. It was a good session with you. And as we discussed, we are going to improve the quality in the next session. And you can also prepare second session, second role play card. I will send you now. So today you will do 2 role play cards. Then after you finish these 2 role play cards, then I'll give you writing. And then we'll do reading and listening also. Okay.
Okay, sir. Sure.
Okay. Okay. Then that's the end of the session. Have a nice day.
Okay.
If anybody is interested in sessions like this, you can just contact me on +91 98 778 67360 98